Good afternoon. Welcome to TNC Radio.live. This is the Truckers Network radio show. And now here's your host, Shelley Johnson.
Thank you, Tom. I appreciate that. Yes, this is the Truckers Network radio show on TNC Radio.live, where we offer the news, information, traffic, weather, sports, and entertainment our commercial drivers want and need. A recent study shows that 40% of truck drivers are looking for new jobs in the industry, and trucking companies are also looking for new ways to attract and retain talent. One of those is to offer great benefits such as health insurance. Health insurance is a concern for companies, drivers, and owner-operators. It's a huge topic. Imagine360 offers self-funded health plan solutions that are different from the one-size-fits-all insurance. They even tailor plans for the transportation industry. With us today is Chris Sigaran, Chief Commercial Officer at Imagine360, that works closely with trucking companies on health management and benefit strategy and delivery. Welcome, Chris. Thank you for being on the show with us today.
Thanks, Shelley. It's great to be here.
You know, health insurance, like I said before, it's a huge topic. Everybody's talking about it. Nobody's happy with all the changes. What is happening with health insurance today? What are some of the biggest concerns and issues?
Well, that's a long list. We only have an hour, so I'll try to hit some of the high level pieces. If you think about it, right, in what we call the commercial health insurance space, that means generally that employers are sponsoring health insurance for their employees. It's what I would describe technically as a big mess. And so, if you start with just some high level data, not to geek out on this too much, but why not for a little bit? In 1960, healthcare in this country, in the United States, was 6% of GDP. Right? That's a lot of money, but it was 6%. Mm-hmm. Now, it's at 19% of GDP.
Okay.
Right? So the growth is just astronomical. And if you think about if you're an employee, right, if you're an employer, and we now, as an organization, have about 50 different trucking companies, transportation companies that we're working with. You have small employers that have about 40 to 50 employees, up to thousands of employees. They're spending, as they come to us, about $8,300 per employee. Family coverage right now is about $20,000 a family, and the increases every year are ranging from 5 to 15%. And so you think about that money, and people tend to think about health insurance as the insurance company pays, right? If I go to the doctor or if I go to the hospital, God forbid, well, the insurance company is going to pay for it. And that's actually not true in commercial health insurance. Your employer is paying it. And when the employer is paying $8,000 an employee, that's money that's not going into salaries and bonuses and all the other things that, as an employee, you would rather see that money go to. And so, again, technically, it is a gigantic mess. There are some solutions out there, but it is something's got to change. We're in a completely unacceptable situation right now.
It's not sustainable. I mean, you've got insurance that costs more than a house payment in many cases.
I totally agree. If you think about it, and you're making $70,000 a year, you're bringing home $50,000 a year. You've got a family that's on your health insurance plan. A lot of those the increases that have happened over the past 15 years, we've seen these high deductible plans creep in. Mm-hmm. And so if my take home is $50,000 a year, and you're right, I've got a mortgage or I've got rent, I've got food, electricity, fuel, et cetera, all these different. Well, if I go to the hospital and I'm, I get a CT scan and I'm paying $3,000 for that CT scan, what am I not going to pay to pay that? I describe it as people are basically functionally uninsured in terms of the average American.
That's scary. You have something that's catastrophic that happens, it's going to bankrupt you.
Absolutely. And I think it's a third of Americans have some kind of medical debt. Right. And so this is not a problem that's affecting a couple people in this country. I'm here, by the way, today to just be a ray of sunshine and light and really cheer everybody up who's out there on the road.
No, you're talking realistically, and that's what people want to hear. How the heck did all of this happen? And of course, you've got really high premiums and then also really high deductibles, 7, 8,000. That's not uncommon today.
Absolutely.
Before the insurance ever even starts paying anything. And if you're lucky, you have an 80-20 split.
Exactly. That's exactly right. One of the problems, and our organization spends a lot of time looking at sort of what's causing this problem. And one of the things you look at and you say, all right, well, how is this so just bizarre in terms of the increases? Nothing else in this country increases like health insurance does.
Mm-hmm.
And you look at what happens in the hospital, and Medicare is sort of the largest payer for healthcare in the country. And you look at what Medicare pays for a service, and then what we pay as employees and employers for the exact same service. And a group called RAND did a study, started probably 5 or 6 years ago, and they now continuously do releases on the same study. But what they found was commercial payers, right? So again, that's us, that's you and me and our employers, are paying on average 2.24 times what Medicare pays for the exact same service. So if a Medicare member goes into the hospital and gets a CT scan, it's going to cost them one thing. If you or I go in, we get the exact same service, we're going to pay almost 2.5 times what Medicare pays for the exact same service. And there's a big misconception in the country that the hospitals, and again, this is not a good and evil scenario. This is just a system that's gotten a little bit out of control.
Mm-hmm.
Hospitals make money on Medicare, right? A hospital generally gets 50% of their revenue, right, of their sales, is how they look at it, from Medicare. They make money on Medicare. There is absolutely no reason that you and I should pay 2.24 times on average more than Medicare pays for the exact same thing. It's complete bonkers.
Which is interesting because they will say that Medicare, they don't make money on.
Yes,
doctors will say they don't want to take Medicare or accept Medicare. So if you are a Medicare patient, you have to pay the difference.
Yes. And again, there's in healthcare is really strange. When you go to we can have some fun with this, right? If you go to the hospital, you start getting things in the mail, right? This is not a bill, right? Nobody else sends you a bill that says this is not a bill, right? The first thing you get is this is not a bill.
Mm-hmm.
It has a bunch of stuff that's really hard to understand. And then you get a hospital bill, and then separately you get a physician bill.
Yep.
Right. It'd be like going to the restaurant, and then you get a bill from the waiter, and then you get a bill from the line cook. Right. It's just, anyway, but that's how
I like that analogy.
Right?
Yeah.
I mean, that's how it works in healthcare. Physicians generally are paid a fair rate. Hospitals, on the other hand, their charges are they don't match any kind of reality. And I'll give you an example. A CT scan, otherwise known as a CAT scan, we know what Medicare pays because each hospital has to report into this American Hospital Directory what they're paid by Medicare for a service. So we know, and I'll give you some real numbers, right? So for a CT scan, Medicare in a specific hospital in Charlotte, North Carolina, pays $152. Mm-hmm. All right. We also know, because the hospital reports, that the cost for that CT scan is $90. Okay. So you can just tell with those two numbers, right? If it costs $90, right? I'm not a math expert, but if something costs me $90 and I'm selling it for $152, I'm making money on that.
Mm-hmm.
Right.
Right.
Pretty straightforward. Well, hospitals have these things called billed charges. You'll see in the news sometimes it's called the charge master. And the charge master, or billed charges, is basically a made up number that the hospital creates for each service within the hospital, that then when a health insurance company comes in, the health insurance company negotiates what's called a discount off of that bill charge number. The parallel I would use is, I live in Nashville, Tennessee, and as I'm getting on the highway, there's a carpet store that has been going out of business for 30 years, right? Mm-hmm. And it's 50% off, right? And it's been that way forever. And it's not going out of business, right? They've just jacked their prices way up, and then they get you in the door by saying it's a 50% discount. Hospitals work the exact same way. It's a made up price, and then they make it sound good by giving you a discount off of that made up number. And so in this hospital in Charlotte, North Carolina, and I could give you an example of every hospital in the country that looks just like this, the bill charge, right? So that made up number is $2,290.
Oh my goodness, it's just ridiculous.
Right. And so you go and you've got one of the big health insurance companies and you get a 50% discount, and that bill's $1,000, right? $1,076. Mm-hmm. And again, the cost of the service was $90.
How is this not price gouging?
It is price gouging. I would say, again, that's exactly what it is. And so I think that the hard part is, for whatever reason, because it's really confusing, not many people understand how it actually works. And when you do, and again, I spend a lot of my time talking about this, generally people get really angry. And, we work with people who are dealing with these bills and explain to them what's going on and support them through that process. And I think they're glad to just understand how it works, and then they get mad because a lot of these hospitals are nonprofits. Right?
Yeah.
They're not paying taxes.
Exactly. Right? Of any kind. Yep.
Exactly. University of Pittsburgh Medical Center, right? One of the largest landowners in Pittsburgh is a nonprofit. If you go and I'll pick on Pittsburgh, which is a great city for a second, but if you go into Pittsburgh, two of the largest buildings in downtown Pittsburgh are the two big healthcare companies, right? The hospitals and the insurance companies.
Yep.
That's not by accident. And
they buy up all the real estate.
And if you don't have to pay, right, we'd all like to not to pay any taxes. That would be great, right? Mm-hmm. So, how our model works and just if I may, is, we look at, rather than doing a discount off of a made up number, what we do is we say, hey, we want to pay a fair price, right? And fair to me has always meant, I think it's fair and you think it's fair, right? And if we can find that price, right, then that's fair. And so we look at the cost of the service, right, which in this case was $90. And we look at what Medicare pays, and we're going to pay either what the cost is plus 12%, or what Medicare pays plus 20%, whichever's higher. And so in this case, our members would pay $182. And so you can see there's a big difference between $1,000 that you're going to pay with the big carrier, or about $200, which you'd pay with us. And again, we're just trying to bring some rational thinking to healthcare, because back to that family that's, their take home pay is $50,000. If they go in and get that CT scan and they've got a high deductible, just like you were talking about, there's a big difference in paying a $1,000 bill and paying a $182 bill.
You betcha. And it's so counterproductive. If you're not feeling good and you see a bill like that knocks your socks off, it is just awful. And that can add up so quickly. It keeps people away from getting preventive care and everything else, too.
No question about that.
Well, I definitely want to delve further into this. I know that we need to go to break here. There's so many things to talk about. Like you said, Chris, we only have an hour. You're listening to the Truckers Network radio show here on TNCRadio.live. We're talking about health insurance and healthcare costs with Chris Sigaran, Chief Commercial Officer at Imagine360. I can't wait to learn more of his insights here. So stay tuned right here on TNCRadio.live.
5 common health hazards truck drivers face. A healthy lifestyle is often overlooked by most truckers. Due to work conditions in the trucking industry, it's difficult for truckers to live a healthy lifestyle. Living on the road makes it hard for truckers to prioritize their health. Truck drivers have limited access to healthy food, lack of sleep, and exercise. Due to their work and living conditions, truck drivers statistically have more health problems. It's important for truck drivers to be aware of the common health hazards they face. To live a long, healthy life, truckers will have to focus on their health and make a conscious effort to be healthy. Sleep apnea. Sleep is crucial for truck drivers. Lack of sleep can make driving dangerous. A study shows that long-haul truck drivers obtain less sleep than the required amount for alertness on the job. Truckers need a good night's sleep to be fully alert and ready to take on the road the next morning. Getting a good night's sleep is crucial for keeping a truck driver alert and productive. Truck drivers travel several hundred miles each day. To reach their destination on time, they'll have to prioritize sleep so they can be alert and ready. Obesity. When you live in a tiny truck cab and drive for 11 hours a day, it becomes increasingly difficult to maintain a healthy lifestyle. As a result, obesity is a terrible problem that American truck drivers face. According to the American Dietetic Association, 86% of truck drivers are obese. Healthy food is hard to come by while driving and working on the road. Truck stops offer greasy, high-calorie food rather than healthy fruits and vegetables. It's important for truck drivers to be conscious of what they eat. There are many other health risks that come with fast food and truck stop food. High blood pressure, also known as hypertension, is a silent killer of both your health and trucking career. A poor diet, smoking, obesity, lack of exercise are causes of high blood pressure. Truckers need to be aware of the causes of high blood pressure and take necessary steps to avoid them. Not only does high blood pressure put your life at risk, it can also disqualify you from driving. Truckers with stage 3 hypertension, that's 180 over 110, are automatically disqualified. Depression. Truck drivers spend a significant amount of time away from home and their loved ones. They also work alone for 11 hours a day. It's not uncommon for truckers to start to develop symptoms of depression. Truck driving's not an easy job. It comes with a lot of stress and anxiety. Depression not only affects a person mentally, it also affects you physically. Depression affects your energy levels and the amount of sleep you get. It can also cause a change in appetite, headaches, and muscle aches. It's important for truck drivers to consider their mental health as well as their physical health. This blog on tncradio.live is brought to you by the Truckers Network at app.thetruckersnetwork.net.
Do you feel like you're facing more than just the physical road ahead of you? Are you wondering if there's more to life? Join Ron Frazier, the host of Truckers Life Radio, every Monday night at 9 p.m. Eastern, where he discusses the spiritual side of a driver's life. On the show, he goes through the spiritual and moral questions drivers face on a daily basis, helping you, the driver, as you travel life's highway.
Welcome back to the Truckers Network radio show on TNCRadio.live. I'm Shelley Johnson with Tom Kelly, and we're talking with health insurance and healthcare expert and chief commercial officer at Imagine360, Chris Sigaran. Chris, we were talking about just some scenarios and what's happened in the healthcare pricing, which it really feels like it's come off the rails, and it's just plain scary for most people. How did all of this happen? Because, I mean, it's just not sustainable.
Yeah, that's right. And yeah, I have an opinion about that. I wouldn't claim to have all the answers. And part of this is if you think about who negotiates with the hospitals, it's really 4 big insurance companies, so Blue Cross, United, Cigna, and Aetna. And all of those insurance companies have commercial business, right? The business that you and I are talking about in terms of employer-sponsored care. But they also get a lot, and in some cases, the majority of their revenue from other lines of business, Medicare Advantage, Medicaid, and the like. And so when they're negotiating with a hospital, right, they have to be very conscious of the negotiation and what negotiations they're doing on one side and the impact that's going to have on other lines of business. And if they're making more money, if you think about it, they're not taking what's called, and to get into the insurance part of this a little bit, they're not taking risk on self-insured business, right? Because if I'm a self-insured employer, and that's an employer that, you know, can be as low as 50 employees up to the largest companies in the country, right? Where the company realizes that they're better off taking the risk themselves as opposed to letting the insurance company take the risk. Mm-hmm. Well, what that means is when an employer takes the risk away from the insurance company makes less money. right? And on the government side of the business, on the Medicare Advantage side of the business, the insurance company has the opportunity to make a lot more money. And so I won't give you an answer, but I'll ask you a question. If you were the insurance company, where would you negotiate harder? Right? Which line of business? Where you're making a lot of money or not making as much money?
Well, obviously the incentives where you make the money. Sure.
Right. And so as employers, right, and I'm an employer, we've got about 1,300 employees within our organization. Most employers have, I would say, abdicated responsibility of that negotiation for one of the most expensive things in their business to a large health insurance company that has a conflict of interest in terms of the negotiation. And so you think about it, in the transportation industry, all the things that you negotiate really hard on, fuel, equipment, everything, right? Every penny is watched. Well, I would ask you, what about healthcare, right? Are we spending as much time looking at really, understanding where all this money that we're spending is going? Because if we're not, then I would say we're not living up to our fiduciary duty. And that is part of the responsibility of an organization under ERISA. So it's just something that I think everybody's kind of waking up to right now because it's gotten so expensive. Mm-hmm. And we work with a lot of CEOs and CFOs of small businesses and large businesses that when they understand how much money they're spending on this and how bonkers the system is, first they get angry and then they want to do something about it.
Sure. Well, I think a lot of people feel like they've lost their leverage, and quite often they'll have a healthcare policy that's an HMO versus a PPO. And they're being told where they can get their care, and they have to get permission for this and that. And then when they get the bill, they're like, what? People have nothing but frustration and fear when you think about it.
No, I think that's right. I think part of the question, though, that we've got to ask is, it's the old, what am I willing to give up to get what I want? Mm-hmm. And so if I want a system where I can go anywhere and I don't have to worry about how much it costs, that is in any business, the most expensive scenario, right? And we don't in our companies purchase anything like that outside of healthcare. And so I think healthcare has come to a point where we've got to start looking at cost and quality, right? Mm-hmm. And again, you think about how crazy the healthcare system is. You go to the hospital, you're asked to sign like 4 things that even if you had a lawyer with you, the lawyer wouldn't be able to understand it. You sign your life away, you have a procedure done, and then 3 months later, they send you the bill, right? And I mean, again, imagine if the trucking business worked like that, right? We're going to deliver this for you. And then in 3 months, we're going to tell you how much it costs. No, nobody would put up with that.
No. Mm-mm.
Well, but like you said earlier, but the bill changes. So the first bill might be $2,000, and then you get a bill for $3,000, and then you get a bill for $1,800, and it's all for the same thing. And then you get some physician who you don't even remember seeing. Right. It's like,
well, you may not have ever seen.
Yeah. Well, and I'm thinking the OBGYN probably didn't spend a lot of time with me.
Right.
That's just what I'm thinking. But, and it's like, where does this even come from?
It's a fabulous point. We spend, right, when we get a claim from one of our members, the first thing we're doing is auditing the claim. All right. You bring up a great point. Back surgery, and we're looking, how many screws were used in the surgery versus how many are we getting charged for? All right. Mm-hmm. Because just because you opened the bag doesn't mean you're using all 10. Right. And so don't charge me for 10 when you use 3. Right. Figure out a way to use the other 7. Did the OB show up? If so, why? And we had a case where the person went to the ER, with COPD, so pulmonary disease, ended up in a burn unit because the beds were full. Right. And then they get a burn unit charge. It's like that's like a $2,000 hotel room. They just put them there. They didn't have burn unit care. But that was the empty bed. You just don't get to do that. And again, when we're auditing the bills, we're catching these things and making sure members aren't paying for them because they shouldn't. And there's all this inside baseball lingo in healthcare. One of them is the auto adjudication rate, which basically that means claims get paid really fast. A high auto adjudication rate, which most of the carriers have, makes the providers really happy. But it also means nobody is checking the bill before the money goes out the door.
Yeah. And, it's kind of interesting what will sneak into a bill. I had surgery. I had a septoplasty done about 20 years ago for my sinuses. And there was something in the bill. And at the time, I happened to be writing about medical coding. So I had all the coding books.
Oh, that's great.
So that made me dangerous. Yes. Anyway, I'm looking through the bill and I see this something for a juvenile pediatric. It was a pediatric charge. I'm like, what? And I called the hospital. I said, it's been a long time since I've been a pediatric patient. Right. This should not be on the bill. And then I called the insurance company to let them know. And the insurance company at the time didn't seem all that concerned about it. Of course, I wasn't going to pay for something that didn't apply, And I remember saying something about the code, and the hospital said, "Are you a nurse?" I said, "No, but I do have a coding book in front of me."
That's fabulous.
It really felt like they were trying to sneak something in.
And I think there are scenarios where it is sort of bad actors. Mm-hmm. I think a lot of it is just sloppy, and I think there's some sloppiness that's really unacceptable in hospital billing that we've allowed to go on for too long. Mm-hmm. And I think you have to, when you get those bills, you've got to review them. Yep. And you need to pick up the phone and call the billing department, and it's a pain in the neck. But I promise you, in a lot of those bills, there are errors. And being the person that calls in and creates a little bit of a stir is the right way to do it. The other piece, and we talked about a little bit on the break, most hospitals in this country are legally required to provide financial assistance and in some cases free care to people who are making I think it's 2 to 3 times the poverty level. 2 to 3 times the poverty level is a lot of money. And so there are a lot of people in this country, and I'm sure there are a lot of people on this call that have medical debt and are entitled to free or significantly discounted care at their local hospitals. Mm-hmm. It's the best kept secret in the country. If you look up within the hospital, the financial assistance department, and you call in and you take care of the paperwork, you can do it before you get the care. You can do it after the care, but it's something that we've spent a lot of time as an organization trying to educate people about what they are entitled to under the law. Because again, that nonprofit status comes with responsibility, and it's an important piece to know.
And it's kind of interesting when people talk to the hospital that has a nonprofit status and says, "Hey, you have obligations." They don't like that. They don't like you knowing that.
That's right. Exactly right.
And there needs to be transparency, which there isn't, unfortunately. No. I mean, you take your car in for service, you get a call usually after they look at the vehicle, and they give you a list of what they got to do, and this is what it's going to cost. And you either say yay or nay,
That's right. And what the healthcare industry has stood on to this point, and this is changing, right, is it's too hard for me to tell you how much it's going to cost. Mm-hmm. And that's no longer an acceptable answer. And so for everyone who's listening, it is now your right to ask before the procedure how much it's going to cost, and they've got to give you an estimate. Mm-hmm. They have to. And it's too hard is no longer an acceptable answer.
And they're supposed to break down the charges too, I would think, which they don't always do. So there's a lack of transparency there.
There is. And all the hospitals now are supposed to be publishing the prices, which I think the last data I saw on that was, I think 20% of them are participating in that.
No, they're pushing back on that. They don't want people to know. You could shop it,
Exactly. It keeps it interesting.
Yes, it does. Well, your insight is terrific here, Chris. I know that we have to go to break, but I want to delve into more of what your company does, what people need to be mindful of, how they can be educated when dealing with their health care. It feels like you have to go back to school to do all these things today. You're listening to the Truckers Network radio show here on tncradio.live. Stay tuned for more great information coming up.
This blog on tncradio.live is brought to you by the Truckers Network at app.thetruckersnetwork.net. 5 best scenic drives for truck drivers. One of the many benefits of being a truck driver is traveling the beautiful United States. Truck drivers spend their life on the road. Although they may get tired of driving, there's still routes and attractions most look forward to seeing. Whether it be cruising down the coast of California, driving in the Smoky Mountains, or passing through the Arizona desert, truck drivers all have their personal favorites. Here are the 5 most beautiful scenic drives rated by truck drivers. Pacific Coast Highway. The Pacific Coast in California, also called Highway 1, is one of the most iconic scenic drives in the United States. Driving along the Pacific Coast reminds you of a movie or TV show. It's about 650 miles long and runs from Capistrano Beach in Orange County to Leggett in northern Mendocino. San Juan Skyway. San Juan Skyway, a scenic byway in Colorado, is known for its million-dollar views. The byway goes across the San Juan National Forest and has provided truckers with beautiful views of the mountains and landscape. Beartooth Highway. Beartooth Highway in Montana is a 68-mile byway that runs through southwest Montana and northwest Wyoming and goes into Yellowstone National Park. Along this drive, you'll see one of the most diverse ecosystems accessible by vehicle in the United States. Keep in mind that the scenic highway closes in the winter due to adverse winter conditions and typically opens up on Memorial Day weekend. I-64 in West Virginia. West Virginia has some of the most beautiful landscapes on the East Coast. Driving down I-64 in West Virginia feels like you're in a painting. If you have time to stop along your truck route, check out Tamarack, located just off I-64 in Beckley, West Virginia. Tamarack is a unique culture center with art from local artisans and delicious food. If you want the full Appalachian experience, check out Tamarack. Utah's Route 12. Utah's Route 12 is one of the most scenic routes in the United States. It's often called the All-American Road. Also, there are 2 national parks at each end of the road, Bryce Canyon and Capitol Reef, and many other unique scenic views. This info blog was brought to you by the Truckers Network at app.thetruckersnetwork.net.
This is Alec Debogorski, and you are listening to TNCradio.live.
Welcome back to the Truckers Network radio show on TNCradio.live. I'm Shelley Johnson with Tom Kelly. We're talking with Chris Cigaran, Chief Commercial Officer at Imagine360. Chris, you've got some terrific insight into healthcare costs. I know our listeners are saying, yeah, you're making total sense here. What exactly does Imagine360 do with health insurance? I understand you tailor programs for the transportation industry.
We do, and thanks again for having me. This has been a lot of fun so far. So basically, our organization is an alternative to the big insurance carriers. So, we're a large organization as far as we're concerned, but compared to the behemoths of the health insurance companies, for the Blues, United, Aetna, and Cigna, we're a small company. We pride ourselves on just working with self-insured employers. So, our motive is to make health insurance fair. And again, back to what I think fair is defined by, I think it's fair and you think it's fair, and to be advocates for our employer clients, their employees, and their family members. And so rather than doing contracts, back to what we were talking about earlier, with a discount off of a made up number, we're paying claims differently. And again, we're using what the actual cost of care is for the facility, or what Medicare pays, and paying a fair margin above those numbers. So the savings is significant. People come to us, our trucking industry clients and our clients from across the country. We work with, I think, about 800 employers from across the country. We pay claims in all 50 states. The clients come to us because they're fed up with the status quo, they're tired of it, and they're ready for a different solution, and they want to save money, right? And so we save our clients and their members between 15 and 30% off their healthcare costs in their first year. We have a full health plan solution. We have our own third-party administrator, cards, the call center, the whole deal that you get with a normal carrier. It's just a different solution, and it's a solution focused on the member, focused on saving money, and focused on getting people access to care. And so that's really what we do as an organization. And I've worked in healthcare now for about 25 years. I've always been fortunate enough to work on what I would call sort of the right side of healthcare, where, sort of fighting against the status quo and trying to change things for the better for working families who are who need the help and need the support.
So for those who don't know what it means, what is self-insured?
That's a great question, right? So how insurance works, right? Insurance works based on if you're an individual, you have to be fully insured, which means somebody else has to take the risk, because I may be healthy today, but something may happen, God forbid, and I may get sick, or I may end up in the hospital, and the risk for an individual is high because you just don't know. The more people you get in that risk, what's called a risk pool, the more likely it is that you can spread it across the group. And what that means is, if you've got 50 people, you may have 5 that are really expensive, 20 that are really cheap, and then the rest in the middle, right? And so the larger that number gets, the more likely you are to save money by being self-insured, as opposed to letting the health insurance company cover the risk. What the health insurance company does, when they're the insurer, they're going to take thousands and hundreds of thousands of people and then put them into a big pool, and they're going to make a lot of money, right? And so if all those people pay their premiums and more people don't use care than do use care, essentially, they're going to keep the difference. And what employers figured out a long time ago is health insurance companies make a lot of money on that. And switching for an employer to switch from being fully insured to self-insured makes a lot of sense. I'll give you a personal example. A long time ago, I ran HR in what was a small company that became a big company. And I had been asked to run HR by the CEO, and the CEO came in my office and he said, hey, I want you to run HR this one day. And when he first called me to his office, I thought I was in trouble, but he's like, I want you to run HR. And I was like, well, I'm not an HR person. He said, that's why I want you to do it. I'm like, okay, I'll figure it out. And so at that time we had a couple thousand people, and there was this guy who showed up every Friday, and he would give Titans tickets to our head of benefits. And this is the strangest thing I've ever seen, right? This guy just shows up. I don't know who this guy is. And he gives this guy who works for me Titans tickets. I'm like, this is a pretty good deal. And so I asked somebody, I'm like, who's this guy who shows up? And the answer was, well, he's our benefits broker. I was like, well, what's a benefits broker do? And a benefits broker sort of supports you in making decisions for your health benefits. I'm like, okay. And so I called a friend, and I was like, and I told her what was going on. And she said, send me your 5,500. And 5,500 is just a fancy way to say all the details on your benefits plan and who's getting paid what. And so I sent it to her, and she said, he's dropping off those Titans tickets because you're paying him $500,000 a year. And so
those are some expensive tickets.
So on Monday, we no longer had that benefits broker, as you could imagine.
Yeah.
Right. And the deal was, right, we had gone from being a small company and being fully insured and hadn't made the switch yet. And so again, you got to understand the game. You've got to understand how much money as an employer you're spending on health insurance. You've got to understand how much you're paying your broker. If you don't already, you need to ask hard questions, and it should be transparent. If you don't know, the good news is if you don't know and you haven't asked those questions, you have the opportunity to save a ton of money and to get a broker or a consultant on the benefits side who will really help you. And those are the kind of employers I love working with, because you can go in, they really haven't done anything. You can save them a bunch of money. They reinvest that money back into the business, back into their employees, back into salary and wages and bonuses. And most employees would rather have a raise than another dollar to go into their benefits that they never see. And so that's a long answer to your question, but that's kind of sort of how that whole thing works.
Mm-hmm. So self-insured, how do you tailor a program like that? You say that the company is self-insured, but they go through you folks. How does all of this work?
So let's just take an example. So the normal example is we get contacted by an employer, it's a CEO or a CFO or the head of HR within an employer, if they have an HR team, or we get contacted by the broker, and the broker says, "Hey, we've been with such and such company, has been with Blue Cross for 20 years. They're self-insured. We'll say they're fully insured. They're fully insured. They have 200 employees, and we just got an increase for next year that's 25%. And this happens all the time, right? So because of their quote unquote experience, their rates are going to go up 25%, which is unaffordable for most employees. So we would work with the benefits broker, consultant, and the employer to understand the population. We would do a savings analysis to show them, based on our model, how much money we'll save them in the first year. We would work with, and not to get too technical, but to get a little technical, what's called stop loss insurance. And that's basically like if something really bad happens, we want to make sure for a smaller employer that they're covered. It's the step away from being fully insured. And we would put all that together in partnership with the benefits broker and the organization. Do open enrollment, which generally happens in October for most organizations. We would be on site to educate the members for open enrollment, and then January 1st we go live with the new plan, and you're sort of off to the races. One of the things we're proud of, and we've been in business for about 15 years. Our first client, Langdale Industries, largest private landowner in the state of Georgia, is still a client of ours. And so, we take sort of making promises and keeping promises very seriously within our organization, and are really proud to work with, I think, about 800 employers across the country.
Now, so when a company is self-insured, does that mean that if an employee has a medical bill, the employer picks up that bill? How
Yes.
does that work?
Yes, that's exactly right. And so rather than, you think about at a very high level, the two different ways it works. If you're fully insured, basically the employer is paying a bunch of money to the insurance company that goes into a big pot to pay for the claims, right? And then any of that money that's not used to pay the claims, the health insurance company keeps, right? And if perchance, and it happens sometimes, it very, very, very rarely happens, but it does happen, if the employees spend more money than went into the pot, then the insurance company, they get to eat that difference. Does that make sense?
Yeah, it does.
Right.
Okay.
And so when you move to being self-insured, you say, hey, I'm betting that we're going to spend less than that, and I want to keep the difference. And so I'm going to take the risk. And so the employer puts away that same pot of money, pays the claims through the year, has, what I mentioned, stop loss insurance in case there's some sort of tragic accident. There are some claims that are super high cost. So you get what's called stop loss insurance to cover yourself as an employer in case that happens. And then again, when you spend less than you put in the pot, then you as the employer get to keep the money. There are also administrative fees that go into that fully insured bucket that you're not paying when you move to being self-insured. I think generally, with very, very, very few exceptions, employers, when you get to 100 employees, you should really look hard at moving from being fully insured to being self-insured. There's a bunch of savings to be made there. There are a lot of brokers that are resistant to doing it because, back to my example, they're getting paid a lot of money to keep employers being fully insured.
Oh, sure. They don't want to lose that pot of gold, if you will.
That's right. And again, that's just why it's important to understand everybody who's working for you, right? How much money are they making and how are they making it? You're not saying that people aren't entitled to make a fair wage. You just want to know how much you're paying everybody and where every dollar's going.
Sure, exactly. You don't want to have a gold-plated car when you don't need one, right?
Yes. If somebody's dropping off football tickets every Friday, you should probably understand how much you're paying that person.
And based on what you were paying that particular individual, those were some really expensive tickets.
Yes.
To say the least. Yes. I want to delve more into where people can get a hold of your company and everything, Chris, but we do have to go to break here. You're listening to the Truckers Network radio show on TNCRadio.live. We're talking with Chris Segaran. He's the Chief Commercial Officer at Imagine360. Stay tuned for more great information coming up. Welcome back to the Truckers Network radio show on TNCRadio.live. I'm Shelley Johnson with Tom Kelly. We're talking with Chris Segaran. He's the Chief Commercial Officer at Imagine360. We're talking about health insurance, healthcare costs, all of the above. It's definitely something that is on everybody's mind. Chris, what kind of plans do you have? You can tailor things to the transportation industry. What kind of plans do you have?
So, I would say you've seen one plan, and really what we want to do is we want to meet with an employer, understand what the desired outcomes that they have, understand, the geographies that they cover, the number of employees, the family members, understand their data, and then work with them and their broker or consultant, if they have one, to design a plan that's going to meet their needs, right? We have employers that are focused on, hey, we've got to save money. The economy is headed towards a really rough spot where before, we were ordering new trucks because we had to decline new business. And now we're on the other side of that and we're looking for every penny. And we have employers that are really doing this proactively because they think in the coming years, they're going to need to get ahead of this. But I think the most important thing about us is it's not a cookie cutter approach. We're really looking at this in terms of what's an employer really want to do. And how do we tailor a plan to make that make sense? At the end of the day, though, people are coming to us because they want to save money on their health insurance.
Oh, absolutely. And I'm sure that there's some drivers listening who are interested. They might go to their employer and say, you really need to talk to these guys. Do the plans that you have, can it be honored in all states? Because obviously drivers are traveling a lot, and that's where they get hung up too.
Absolutely, yes. We've got folks in all 50 states and are quote unquote paying claims in all 50 states. So yes. And again, as I mentioned, I think we have almost about 30,000 members that are part of the trucking industry, about 600,000 members across the country.
Now, are these member facilities that
individual members that are on our plan.
I see. Okay.
Within the, say, 50 trucking companies that we work with.
Okay. Good to know.
Yes.
Yeah. I mean, this sounds like a real, it seems like common sense.
That's what I say, right? Again, healthcare doesn't have to be so complicated. Uh-huh. And again, I think we're just taking a common sense approach, just like you would if you were, paying any kind of bill. But that just hasn't been the normal way that this has worked, over the past 30 years. And again, what we're trying to do is create change that gives people their money back, essentially, and lets businesses invest in the things they want to, not just paying more for healthcare every year.
Does this give the employee more freedom, maybe to see the doctors they want to, as opposed to like an HMO where they're kind of often in like a narrow network where they can only see something maybe that's a block away from the hospital?
Yes, it does. It does. And it requires employers and employees to be more engaged in their healthcare. Okay. Right. So again, if you want a system where you don't have to think about how much things cost, you don't have to think about the quality of care, then probably what you have is a great option. But I'd suggest that's the same system that has created, 19% of GDP and $12,000 high deductible plans. And what we do want is we want employers who care deeply and want to engage differently with the healthcare, with the healthcare system and with us. And for those employers, we're a great fit. And we can save them a bunch of money. And again, there are a lot of employers, and I think, as we think about sort of the economy and where we're headed this year, who really need what we have. And I would say we're busier than we've ever been.
We have less than a minute here, Chris. Where do people reach out to your company?
Great. So I'll give you the website address is www.imagine360.com. So that's www.imagine, imagine360.com. And then I'll give you my email address too. Feel free just to reach out to me directly, which keeps things simple. My last name is a little tricky. So it's CCIGARRAN at imagine360.com. Again, that's CCIGARRAN at imagine360.com. Shoot me a note and I'd be happy to jump on a call or put you in touch with the right person.
Excellent. And I see that your website, you deal with a lot of different industries. So you folks are really in the know on the needs of all different types of companies.
We like to think so. But every day we're learning something new.
Mm-hmm. This has been a wonderful conversation here, Chris. You make so much common sense, and that's so uncommon today.
Well, thank you, Shelley and Tom. It's been great to be with y'all. I really appreciate it.
You have about 15 to 20 seconds. What's your website again?
www.imagine360.com. And again, my email address is CCIGARRAN at imagine360.com.
Thank you so much. You've been listening to the Truckers Network radio show here on TNCRadio.live. Stay tuned for great information and entertainment, especially with our primetime lineup coming up. Stay tuned. Thank you for listening to another great interview on TNCRadio.live and the Truckers Network radio show. All of the material you hear on TNCRadio.live on our website, our broadcasts, or our podcasts are copyrighted. There can be no distribution without the express consent of TNCRadio.live and its partners. For inquiries, write us at info@tncradio.live. And don't forget to subscribe to the podcast of the Truckers Network radio show.